So I decided to do my presentation on specialties within physical therapy and the ones I wanted to specialize in as a PTA, which are oncology and pediatrics. The reason for pediatrics is because I've worked with children for over 6 years as a nanny and daycare teacher, and I want to continue to do so in my career as a PTA. And with oncology, I just feel it's most rewarding. Between the both, they're very rewarding specialties. So then I'll begin with a oncology video of a cancer patient who's going through physical therapy and how it has affected her life overall, and a little visual into her day-to-day, and a visual of like what she does from day-to-day as well.
There's days that I can't get out of bed because my body just hurts so bad, and you're on so many, not only chemo medication, but you're on different home medications.
I'm Laura Bleck, and I've been a physical therapist in the Valley since 1998. And at that time, my former employer had a bunch of us therapists lymphedema certified.
Originally, I started coming because I had a small case of lymphedema, so I thought that's all that I was going to be working on was my right arm, and that was it. But we've been working on strengthening, getting my, heart rate up for cardio, and it's helping me just try to get my strength and energy back. Instead of having to lay in bed all day long, now I can get out and do something. And I snowblowed the last 2 days, and there's probably no way I would have been able to do that if I didn't have the program.
So when the Fox Valley Hematology and Oncology group decided to come this way, we asked if we could be part of their rehab services to offer truly a full, comprehensive care for their patients.
I've gone through different physical therapy before for all sorts of different things like neck injuries, wrist injuries, and she just has that really good personality, kind of like I've been able to kind of open up to her and talk about our families and stuff like that. Just kind of made it feel warm and welcome, like a place that you actually want to come to, instead of like, oh, this is another appointment I gotta sit through for like an hour.
Over the years, working with the cancer population has just, it's been such a rewarding experience that we wanted to do something more for the Valley and truly meet all of their needs. There's studies that show, 65 to 85% of cancer patients will have some sort of functional impairment following their cancer treatment. And as cancer gets looked at more as a chronic disease, it's definitely important that we get these patients in so they can return to their normal jobs, or if they're mothers that have young children at home, that they can be as active with those kids as possible. And so we definitely can help more than just the patient who has that chronic swelling. We can help patients just get back to their normal quality of life.
So to elaborate on what she said, as a PT or PTA who specializes in oncology, we see cancer patients of all ages, post-chemo or post-surgeries, and today we're seeing more and more cancer survivorship, so that leaves them with the aftermath of, the physical limitations. And like that girl in the video, like she said, if she wasn't doing this therapy, she would be laying in bed and wouldn't be getting to do the things that she said that she got to do. So some of the limitations that we might see are lymphedema, pain, nerve damage, incontinence, cancer-related fatigue. All of those things come with the chemo and post-surgeries. And so PTs work together, PT and PTAs work with these cancer patients to help them regain those maximum strength and mobility to go back to their ADLs, their being able to work with their kids or being able to go back to their jobs. Every program is, directed and specific for each patient, so it depends on what you have as to what your plan of care will be. So the next specialty is pediatrics, and I'm just going to show you a video of Ava, who is going through physical therapy.
Ava was born in 26 weeks, almost, I guess, 3.5 months early. Within 2 or 3 months of being home, we noticed that the progression of, reaching and rolling and turning and lifting her head up wasn't coming along as well as we would have liked compared to other kids.
Over the 12 to 14 months that I've been working with her, we've seen a very nice progression and acquisition of skills. And now she's totally independent in her walking. She can run, she can walk upstairs.
I think that was quite a huge part of it. It's made such a huge difference in Ava's life. I couldn't be happier with where she is, how far she's come, and I hope, take each day as it comes, but I think it looks pretty good.
So with pediatrics, we see a lot of children from premature babies like Ava, from the NICU up until the teenage years. They can receive patients with acute and long-term injuries. They can be affected cognitively, their gross and fine motor skills, and we help them with that. I would say the major difference in peds versus other specialties is being creative with what getting the child or infant to do in terms of their therapy. Ava was a premature baby, so she wasn't developing like other kids, so she comes to us and we help her get the maximum strength, range of motion, all of those things to experience the quality of life just like other kids. As children grow up, we have to transition with them to as they grow up, they experience different developments and different levels of skills of different things, and so we help them with that as well. And each, like I said, on oncology, each treatment is designed specifically for whatever that patient comes in for. So with Ava, she was not, being able to, have her head up or reach out. So she came in and we, gave her different therapies and treatments to help her be able to do those things just like normal kids and go back to her daily life. Pediatrics works in a different environments. It could be home, outpatient, schools, clinics, hospitals. There's different environments that they work in, and that's about it. Do you guys have any questions for me?
Yes. Do pediatric PTAs and PTs work with oncology patients, cancer patients?
Yes, PEDS does work with cancer patients. They more specifically see them because they know how to work with kids, and oncology just oversees them and kind of mentors them into more of the treatment, what more to work on specifically.
Okay.
And that concludes my presentation.